Assalamu alaikum, dear students. Once again, welcome to my new lecture. Before starting my lecture, I'd like to thanks to Almighty Allah who enable me to share medical informations to my viewers. So let's see here, let's take a start from the drugs used for the treatment of bronchial asthma. In this lecture, I will easily classify the drugs into different categories. Now let's see here that drug used for the bronchial asthma is divided into four major groups. The first one is Leukotriene Antagonist. The second one is mast cell stabilizers. The third one is Corticosteroids, while the fourth one is anti-IgE antibody. This is very simple and easy to understand. Now, Leukotrienes antagonist are blocker are montelukast and zephyrolocast. These are leukotriene receptor blockers. While the second one is mast cell stabilizers. So mast cell stabilizers are sodium chromoglycate ketotyphins. While the corticosteroids, the third one is corticosteroids category, which is divided into two groups. The first one is systemic, while the second one is inhalationals. So it means that corticosteroids can be administered systemically as well as in inhalatory form. So systemically, these corticosteroid drugs are available, which include hydrocortisones, prednisones, and other glucocorticoids. While in inhalational form, which include beclomethasone, dipropionate, budesonides, and fluticasone propionate, flonazolides, and cyclisonides. While the last one, the fourth one, that is anti-IgE antibody, which include a single drug, that is omalizumab. Okay, now come to all bronchodilators. So you know better about bronchodilators, which can dilate the bronchioles of the lungs. So bronchodilators, they are further divided into three. The first one is beta-2 sympathomimetics, while the second one is methylxanthines, and the third one is antichollinergics. So all these are the drugs which are used in the management, or you can treat a patient with the help of these agents. So beta-2 sympathomimetics, that is salbutamol, terbutaline, bombuterols, salmeterols, and formoterols. While the second one is methylxanthines. So methylxanthines include theophylline, aminopylline, choline, and theophylinate, or hydroxyethyl theophylline, while the last one is doxopylines. The third one is anticholinergics. So if you review, I think lecture number 104, so you can see there the overall background or the pharmacological backgrounds of the anticholinergic drugs. Anticholinergic include ipratropium bromide and tiotropium bromide. So this was all about the classification of the drugs used for the bronchial asthma. Now come toward the preparation and its doses. Drugs for respiratory disorder, the preparations are in the form of, you can see, salbutamol. So salbutamols, that is albuterols. This is the trade name. So salbutamol is available by trade name, that is called albuterol. So albuterol, salbutamol is available at the dose of 2 to 5 2 to 4 milligram. Oral are 0.025, 0.5 milligram. Intramuscularly or subcutaneously 100 to 200 microgram by inhalation. Salbutamol is available in a market by different brand names like Esthelines 2, 4 milligram tablets, 8 milligrams standard is tablet in 2 milligram per 5 ml syrup, 100 microgram meter dose inhalers and 5 milligram per ml respiratory solutions. So it means that salbutamol, there are different brands which are available in the market and you can purchase it. So this is very easy that for example, the brands of salbutamols in the form of tablets, in the form of spray, in the form of solutions, or in the form of syrups. That is 200 microgram rota capsules, cryocells 0.5 milligram per ml, and injection Solalzo 2.5 milligram per 3 ml in injection, ventrolines that is 2 milligram per 5 ml, and then syrup 4 milligram, 8 milligram, many and more drugs. Second one is terbutaline. So terbutaline is also available at the dose of 5 milligram oral, 0.25 milligram subcutaneous, 250 milligram by inhalations. And so actually there are different brands which are available in the market. That is terbutalines, or you can say Brecarex is 2.5, so that is available in 5 milligram tablet, 3 milligram per 5 ml in syrup, and 0.5 milligrams 4 ml in injection. That is you can say 25 to 150 micrograms per meter dose in 10 milligram per ml nebulizer solutions, and Brecanils. That is also available in a dose of 0.5 milligram per ml in injection, 2.5 mg 5 milligram tablet, 1.5 mg per ml. So there are many more drugs that are available in different doses. Another one is bambuterols. So this is another bronchodilating agent, so drug used in the treatment of respiratory disorder. So that is also available at the dose of 10 to 20 milligram OD and the evening. Bambuterols. Bambuterols available in 10 milligram, 20 milligram tablets and 5 milligram per 5 ml oral solutions. For example, Beta-Day 10, 20 milligram tablets. While the fourth one is salmeterol. So salmeterol, they are also available at the dose of 50 to 100 microgram by inhalations, while the salmeter and Serobet at the dose of 25 microgram per meter dose inhalers. 2 puffs Bedi twice a day, and several you can see in case of severe cases 4 puffs Bedi twice a day, also Serobets and Rotacaps. 50 microgram 1 to 2 capsule Bedi by inhalations. So you can see here these are the different brands of the salmeterols which are variables and depend upon the condition of the patient, like Seroflow, that is 100 by 250 milligram, Rotacaps and salmeterol 50 microgram plus fluticasone 100 microgram per 250, so microgram per 500 microgram per Rotacap. Another one is formoterol. So formoterol, that is also available in 12 to 24 microgram by inhalation twice daily, like Fortec 12 micrograms Rotacaps. Another important drug, that is Theophilines, that is anhydrous, which is also at the dose of 100 to 300 milligram TDS, 15 milligram per kg per day. The trade name of Theophilines, actually the brands which are available, that is Theolong 100, 200 milligram standard capsules, and many and more drugs which I have already mentioned here, that is Leucotriens, which is also available in the dose of 400 milligrams, 600 milligrams short tablets, and tubate 200 and 300 milligram tablets. The second one is aminophylline. So aminophylline, that is theophylines, or you can say ethylene diamines. 85% theophylline, water soluble, that can be injected IV but not intramuscularly or subcutaneously. So 250 and 500 milligram oral or slow IV injection. So that is especially in children's, 75 milligram per kg body weight, which I have already discussed in drug calculations, how we can calculate dose for geriatrics, for children, for neonates. Aminophylline, that is also available in 100 milligram tablets, 250 mg for 10 ml injections. So the last one, that is hydroxyethyl theophylline, that is etophyline, 80% theophylline, which contains, so water soluble. It can be injected IV and IM but not subcutaneously, which is also 250 milligram oral or IM IV. So the brands which are available in the market, that is Dairyphylines 100 milligram tablets, 300 mg, sustained release tablet, and 220 milligram for 2 ml injections. Actually, this lecture was about the different doses and its preparations. Actually, the drugs which are used in the treatment of respiratory disorders. We have already discussed all these things in detail. This was a general classification to know about the categories of the drugs, like which I have highlight here. That is Leukotriene Antagonist or blocker, then mast cell stabilizer, then corticosteroid, then anti-Ig antibody, and then bronchodilating agents like sympathomimetics, methylxanthine, and anticholinergics. So please, it is requested to all kindly review all these drugs. So this is very easy to understand, and you can also memorize all the doses along with preparation. So once again, thank you so much for watching my lectures, especially to my viewers and my students. Wish you all the best. Thank you.